my speech is to persuade the audience to support physician-assisted death or dying with dignity laws. The adaptation is for many, death comes as a result of a painful, incurable disease. However, physician-assisted death could change that. I work in a hospital and I have a lot of experience with death. I have watched patients' bodies be kept alive by machines because families weren't ready to let them go. But more importantly is the fact that I helped take care of my stepdad for the last month of his life while his mind, body, and soul was devoured by cancer. During my speech, I will cover what physician-assisted death is and who would benefit from it, the criteria to be eligible and the process to obtain the lethal medication, and lastly, Ohio's stance on physician-assisted death and what supporters can do. I considered passing away in hospice care at my San Francisco Bay Area home. But even with palliative medication, I could develop potentially morphine-resistant pain and suffer personality changes and verbal, cognitive, and motor loss of any kind. Because the rest of my body is young and healthy, I am likely to physically hang on for a long time, even though cancer is eating my mind. I probably would have suffered in hospice care for weeks or even months, and my family would have to watch that. That quote is from a CNN article written by Brittany Maynard, who was 29 when diagnosed with aggressive brain cancer. After having part of her skull and temporal lobe removed in an effort to stop the tumor growth, she found out it was unsuccessful, and that is when she decided to research dying with dignity laws. Dr. Timothy Quill and Dr. Bernard Sussman of the Hastings Center define physician-assisted death as the practice of a physician providing the means for a patient with decision-making capacity to take his or her own life, usually with a prescription of barbiturates that they can take him or herself. Many consider physician-assisted death to be suicide, but there is a difference. Andre Picard of the Globe and Mail described it best when he wrote, "Suicide is an act of self-harm that is almost always a byproduct of a mental illness like schizophrenia or severe depression. This is no way comparable to hastening death via a methodical, sober process with a number of legal safeguards. Ask any terminally ill patient with less than 6 months to live if they really want to die, and chances are they'll say no. Patients seeking physician-assisted death feel that if they can't control the illness, they should at least be able to control how or when they die. According to my survey on SurveyMonkey.com, 100% of participants believe that terminally ill patients should be able to decide an end-of-life plan. And 6 out of 7 listed cancer as one of the 2 diseases a patient should have to be eligible for physician-assisted death. Cancer, ALS, chronic lower respiratory disease, heart disease, and HIV/AIDS are the top 5 diseases patients seeking PAD in Oregon are dying from, according to U.S. News article, "Here's Who Uses Oregon's Death with Dignity Act" by Lindsay Cook. How would you feel if you only had 3 months left to live, counting down the days as the pain got worse and you could no longer bathe, dress, and take care of yourself? Oftentimes, a patient seeks PAD because they want to prevent feeling a loss of sense of self, or they can no longer participate in activities they once enjoyed, or to avoid a loss of dignity. According to the New England Journal of Medicine, patients who chose assisted dying had greater control of their symptoms, and the patient and their families were more prepared and accepting of the death, per Julian Prokopitz and Dr. Lisa Solomon-Langton. As of today, California, Colorado, DC, Oregon, Vermont, Washington, and Montana have death with dignity laws, and after January 1st, 2019, Hawaii will too. In order to be eligible, a patient must be 18 years or older, reside in the state with a dying with dignity law, diagnosed with a terminal illness with less than 6 months to live, and be competent. The patient must also be able to self-administer and ingest the medicine, as a doctor cannot give the medication. 2 doctors must determine if all criteria has been met before a patient is eligible. Sandra Norman Eady's article on Oregon's Death with Dignity Act lists the following steps to obtain the prescription. There has to be 2 oral requests at least 15 days apart and a written request witnessed by 2 people. There's a prescribing doctor and a consulting doctor who must confirm the diagnosis and prognosis along with the capability of the patient to give their medicine. If either doctor believes the patient's judgment is impaired, a psych exam is completed. The patient must also be informed of alternative fees like hospice care or pain management. The doctor must request, but not require, that the patient notify next of kin of the request. In most states, doctors must watch a patient's body and brain inevitably decline until death mercifully comes. So where does Ohio stand? Currently, 24 states, including Ohio, have proposed Death with Dignity Acts in 2018. Supporters of Ohio's Senate Bill 249, Ohio Aid in Dying Act, can urge their legislation to vote in favor of the act by calling or writing them, joining the Death with Dignity movement, and helping educate and advocate for patients. The liberty to think and decide what is best for your life is one of the greatest freedoms we have, yet there are so many that do not want that option available when it is most important at the end of life. In conclusion, PAD is the practice of providing terminally ill patients who meet criteria, the lethal means of ending their life. A patient must be 18 years or older and of sound mind with a prognosis of less than 6 months to live to be eligible. It is a growing concept that is legal in 7 states, but growing support in numerous others. PAD is a practice that allows a terminally ill patient to end their life on their terms, in their way, and when they're ready, without losing their pride or dignity. Thank you.